We are back with another episode of Pottawattamie County Roots. Hi, I'm Todd Studer. Coming up today, well, let's begin with this. There are a lot of classes and opportunities to learn through the county that you might not have been aware of. And some of them go through the health department. Now, health educator Alexis Poling is here today to tell us a little bit more about some of those classes, what they do, how they serve the area, and how you can get involved and actually get signed up for them. So Alexis Poling, health educator for Pottawattamie County, is joining us today on Pottawattamie County Roots. Be sure to start your day at Brewed Awakening in Avoca. They're open Monday through Saturday and always serving something fresh. Enjoy bagels every day, weekly specials that you're not going to find on the menu, and warm seasonal soups every Tuesday and Wednesday. And on Wednesdays and Thursdays, grab a hot breakfast sandwich. Treat yourself to something sweet every Friday. Or if you're hosting a meeting or gathering, Brewed Awakening has a private room ready for your group, free to use if you don't need it all to yourself. Stop in for great coffee, good food, and a friendly hometown atmosphere at Brewed Awakening in Avoca. HR Helix, delivering fractional HR leadership and strategic people solutions for professional firms across our region, including right here in Southwest Iowa. Founded by Amy Luckenbill, HR Helix helps growing organizations that have outgrown do-it-yourself HR, but you're just not ready for a full-time executive yet. From compliance and culture to performance and structure, HR Helix turns complex HR challenges into clear, confident action. Their approach is simple: old school smart, next gen savvy. So if your business is ready for better systems, stronger teams, and leadership support that fits, visit hrhelix.com. And when emergencies happen, confidence saves lives, and Ready Responders 130 provides professional training for individuals, businesses, and community groups, so you know exactly what to do when it matters most. With flexible scheduling, up-to-date information, and dedicated CPR instructors, you get hands-on skills that prepare you for real-world situations. At work, at home, or out in the community, Ready Responders 130 gives you the tools to act fast and act smart. Be prepared. Be confident. Visit ReadyResponders130.com. Joining us this morning, it is Alexis Poling, and she is a health educator with Pottawattamie County. Thank you so much, Alexis, for your time. Great to see you.
Thank you for having me. Good to see you too.
You ever done anything like this before? You ever been on do interviews online or been on a podcast or anything like that?
Never done any sort of thing like this.
Well, hopefully it's not too painful. And we can, when we get done, my goal is to hear you say that's easier than I thought. That's what I'm going for here. Tell us a little bit about your job. What is it that you do for the county?
Oh my goodness. So for the county, what I do is I am a health educator. So I work primarily in the schools and teach teens about healthy relationships, sex ed, mental health, pregnancy prevention, all those things that a health teacher would do, I pretty much do.
So all of those things that kids, they find embarrassing to talk about, but still need to be talked about.
Yeah.
That's your job.
That's my job.
Wow, that's I can't even imagine your day today. But I'm thankful that you're there and grateful that you're doing that kind of work. When I was young, they were just starting to talk about this kind of stuff in schools. Before then, it was, oh, you don't mention it ever.
Yeah.
And I think it was 7th grade. Mr. Anderson, I just thought of him, and not the guy from The Matrix, but I just remembered him. He was our science teacher, and also he was then the health class teacher, and that was our first time ever having anything like that. So now you do this pretty much daily?
Pretty much daily, about that. 3 times a week, hoping to do more, but yeah.
So is this something then that you get together with the schools and the schools set up a time to bring you out? Do you have to go and convince anybody that this is a good idea, or is that part already taken care of?
No, there's really no convincing. We've had great community support over sex ed and teaching our young adolescents about sex ed. We do meet before any of the school year starts just to get a baseline of how many kids, how many students, what we talk about, what's off limits, things like that, and see how parents are doing. But yeah, we just kind of, before any of the school starts, get a baseline and then go from there.
I think that it's vastly important that you have these conversations with young people, just as a reminder that, one decision and life's different.
Right.
Moving forward, it's not just different for a little while, it's different permanently.
Correct. Yes.
Right. So tell me about this class that you have, Roots and Wings. What is this about?
Yeah, so this is a pregnancy support group for any young teen moms. Um, it's just available to have just a spot where they can connect with other adolescents who might be in the same situation, or parenting teens for that matter, and just have a safe space to learn. I mean, financial literacy, communication, things like that they could need or use for their future.
Something about me, I've talked about it on the show many times, but I sit on the board for NAMI Southwest Iowa.
Mhm.
And we obviously talk a lot about in the mental health fields about stigma
Right.
and how that actually can stop someone from getting help when they probably should be getting
Mhm.
help. I sounds to me that this would be that kind of case because you attach that stigma to a teen parent
Right.
and they don't want to go talk to anybody. So getting them in a room with a lot of other young people that are going through the same thing, oh, I can only see how that's a positive experience.
Yeah, it's pretty awesome. I mean, luckily we haven't, I mean, luckily, I don't know how to put this in the records, but we haven't had any teens come to the group yet. But I don't take that as a failure. I'd rather take it as kind of in between. I mean, don't want to see any pregnant teens out there, but
Mhm.
also if we do have them, having the safe space and giving them resources to come and
Well,
be
and
open.
oftentimes, being able to take care of things is planning ahead for possibilities.
Right.
So having this in place, and you got a grant for this, didn't you, in order to be able to
We
put this together?
do. Yeah. So it's the CAP grant, which is community adolescent pregnancy prevention.
Mhm.
Um, and that is just more community based than what we do normally, which is the PrEP grant. So again, with acronyms, but the PrEP grant stands for Personal Responsibility Education Program. And that is just more hands-on. I mean, not hands-on per se, but more curriculum based rather than the CAP grant, which is community. So all about really digging in there, helping teens out where they are, and yeah, just building them up.
Well, thank you very much for explaining the acronyms because I know when you're inside of it. I had a gentleman that's a CPR instructor here recently, and just saying one acronym after another. I said, "What does that mean again?" He said, "Oh, yeah, that's right." Because he's just in that industry, so that's just how they talk. And I'm sure it's the same with you. That
Yes,
you're around this all the time. So thank you very much for being able to explain that to me.
of course.
How do folks learn more information or possibly get signed up for this? Where can they go for that information?
Our website. So it would be under the health education tab under population health, from Pottawattamiecounty.gov, on our public health website. Learn more. There's a bunch of stuff about what we do, what our curriculums are, and our meeting times for the pregnancy support group is also posted on our website too. There's no sign up for the pregnancy support group. Just show up and be present is kind of all we're asking for. So
And with the grant, is there a charge for it for
no,
young people that want to be a part of it?
no, free of charge,
That's
completely free of
excellent.
charge.
That's we really have so many wonderful resources in the place where we live, and this is just another example of that. That you know, we all go through things, and we can use some assistance, and sometimes that assistance just means knowing we're not alone.
Right,
And so this particular class, I'm just imagining that a lot of the class would be a part, that would be a big part of it. Say, hey, look around. You're here together and you have some shared experiences. And sometimes you can get ideas that
right.
way from one person to the next.
Mhm. It's great.
So what else are you working on over there right now? I'm sure that this is a big part of your day, but also it's just a small part of your day. So
Yeah.
I
So
know we were actually going to get together in person, unable to do that because you're crazy busy.
I am rewriting curriculums. I mean, things are constantly changing with the
Yeah.
state.
Oh, sure.
New wording, new verbiage, all those things like that. So constantly making sure we have the most accurate information, and just rewording things that sound easier for teens. I mean, I taught this for a semester, the way it was handed to me, and you start noticing things. I just keep going along and talking to students, and they give you feedback as well. And so now my job is okay before the start of the semester, changing things that I know they care about and want to learn. So it's
You,
pretty much
but
part of my day.
yeah.
Grant writing is always a part of it, reaching out to community partners and schools as well. School I think for Council of School District, they're starting the first semester, I think next week or so. So
Hmm.
trying to get on school schedules, reach out to them, see how they're doing, any ways we can improve. And yeah, there's always something going around in public health. So
You mentioned something there about new verbiage coming out and rewording things and reworking things, and I'm sure uh, probably affected at both the state level and the national level as different regulations and recommendations come out. It's got to be hard to keep up with that sometimes, isn't it? Or maybe here's we just got a new notification. What does this mean
right.
for you? Trying to decipher what is it that we actually have to do here and understand compliance with what the new rules are.
Yes. Well, thankfully, we have IHHS staff that will contact us with any new updates at what we're doing. And then we have an amazing staff. So, our nurses, any other of our staff members, I mean, who are parents first, but also they do their jobs and they're out in the community as well. So, always working as a team, getting input from them on, does this need to be updated? Have you seen anything? And just going along with Iowa HHS and our staff has been amazing.
Something I find fascinating as I've talked with different folks is their why. And I'm going to ask you a question that I've asked others. Is this a career that you searched out or did it find you?
It found me actually, which is kind of funny. So I went to Creighton University, and this was my kind of capstone thing. So I was an intern here for about a year. Well, it was supposed to be a semester, but then I asked my preceptor and I asked my boss, Matt Wyatt, if I could stay the extra year just to get more hands-on, um, just be more hands-on and really get
Hmm.
to know the county. And then there was an opening for health educator and I decided to jump on it. So
And how
I,
far back does that go?
oh my goodness, I've been at the county for almost a year now. So I started
Okay.
full time in May, which has been great. But I've always loved working with kids. And I mean, there's never a dull moment when working with kids. So
Well, that's true. Yeah. I was one once. So I remember, and here's the thing too, that we, as you know, guys with my hair color, we like to say things that all kids today they lack ethic or any this other stuff. I remember hearing the same kind of stuff about my generation from the generation ahead of me, and now we just perpetuate it. And the truth about that is it's not true. That I know so many young people that are out there getting it done, and you're seeing so many wonderful things happening at the school level, and you're seeing kids getting into new careers and getting into getting involved with the trades at a young age, and all of these different things going on. And it's to me it's encouraging. I know that when I hear those kind of comments about young people, I kind of just hold on a minute, look a little harder, and see. And you're around them all the time,
yes.
the young people that are still in school. So I'm preaching to the choir here. There's this is a good generation coming up. I'm optimistic.
They're awesome. They've got so much hope. They have so many goals that they want to accomplish. I mean, I learn something every day from them, so it's a really rewarding job.
Well, Alexis, thank you so much for taking just a little brief moment out of your day to fill us in on what's going on there and also more about your job. So, anytime that you have some information that you want to get out, I hope that you'll let us know. It's Roots and Wings teen parent group. And once you get some folks signed up for that, you're going to meet once a month in the public health building.
Yes.
And so just another great resource that we have in Pottawattamie County. So
Yes.
thank you so much for your time. And
Thank you for having me.
you bet. Now go get some work done, all right?
I will. Thank you.
Right. The Jenny Edmondson Foundation believes healthcare goes beyond hospital walls, and through its Caring for Our Communities initiative, the foundation helps high risk, low income, and underserved individuals access resources that remove barriers to better health and long term well being. Each year, the foundation also brings the community together through Dance for the Beat, a signature event that raises critical funds for uninsured and underinsured heart patients. Those funds help provide treatment, medication, rehabilitation, and life-saving support. Learn more. Get involved and support the mission at jehfoundation.org. For a salon that feels like home, come to Heather's Hair Hut in Underwood, Iowa. Over 30 years of experience, Heather delivers expert haircuts for men, women, and children, and she also offers services like color, styling, and waxing services. This family-friendly salon is open 6 days a week with convenient evening hours, all in town, with a beautiful country view. So, whether you need a quick trim or just a fresh new look, Heather's Hair Hut is the place to be. Heather's Hair Hut in Underwood, where experience meets comfort. And Pottawattamie County Roots brought to you by Dave Lawrence, your Edward Jones financial advisor. Learn how he can help you reach your financial goals. Visit edwardjones.com for more. Edward Jones, member SIPC. Thank you once again to Alexis Poling, county health educator, for joining us today. Great information, and welcome back anytime. I say that a lot, but everyone is. We have one more day to go before the end of the week. My name's Todd Studer, and we'll see you back here tomorrow morning.